Today on This Week Health.
Nothing in the history of mankind from a technology and or from an application perspective has ever gone from 0 to 100 million users in 2 months. That's something to think about.
Welcome to Newsday, a This Week Health newsroom show. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels dedicated to keeping health IT staff current and engaged. For 5 years, we've been making podcasts that amplify great thinking to propel healthcare forward. Special thanks to our Newsday show partners, and we have a lot of them this year, which I am really excited about. Cedars-Sinai Accelerator, Clearsense, CrowdStrike, Digital Scientists, Optimum Healthcare IT, Pure Storage, SureTest, Tausight, Lumion, and VMware. We appreciate them investing in our mission to develop the next generation of health leaders. Now, on to the show.
All right, here we go. We're doing a Newsday episode from ViVE here in Nashville, Tennessee, and we are joined by Charles Boicey, Chief Innovation Officer for Clearsense.
Yeah.
Charles, always good to sit down with you.
Yeah, great to be here, Bill.
In
our booth, yeah.
In your booth, and it's a newly designed booth. The marketing team did a good job. Looks good. All right, so here's what we're going to do. We're going to count the number of times GPT-4 gets said on this episode, and for every time it gets said, we're going to do like punch buggy.
Yeah.
You go ahead and hit them, but we'll also throw $1 towards the Alex's lemonade stand.
What about Chat-GPT 3.5? Same rule applies?
There's $1.
Yeah.
We'll just keep counting them. 3.5 counts. Okay. It's amazing how many just normal conversations it's coming up. And I do want to talk about that. I do want to talk about the conference a little bit. Let's start with this. I just got off the stage with AWS, and we talked about cloud and how cloud brings agility and whatnot to the industry. You're going to be on stage tomorrow?
Yeah, tomorrow. Yeah, we'll talk about trend versus trendy.
Ooh, I love that game with you.
So, flying cars in healthcare.
Flying cars is trendy?
Flying cars are trendy. They've come up every 10 years since 1915.
All right, and what is a trend?
A trend would be something like a data platform, where we've seen it evolve over the last decade or so.
Yeah, that's fantastic. All right, so that's what you're going to talk about tomorrow. And I don't know, what are you seeing at the conference?
What am I seeing?
Yeah, first of all, it's grown.
Oh, it's tremendous. I don't know how many vendors are here or how many healthcare participants, but it's quite interesting. I've seen a lot of people come here to see what the various trends are,
right,
so they can differentiate what's going to be here in the long term versus what's like old technology that may not be here for the near term, and that's it. Also, there's quite a few private equity folks here, VC folks here as well, that I've run into.
And that's the thing that's, I think, distinct about the health conferences, and health is obviously a partnership with Health and Chime, is that they attract that community. In fact, I was just talking to a venture capital person, and we ended up talking about generative AI, quite frankly. This is why we joked about having a punch slug bug kind of thing, because I would say of the 12 interviews I've done so far, at least 10 of them have mentioned Chat-GPT 4.
Did they mention the problems that are likely to be solved, or did they just talk about the hype around it?
Well, it's interesting because I think this crowd generally is talking about the potential, right? We understand that there could be some security issues yet, privacy issues yet. There could still be some hallucinations, as they call them. Yeah, so we understand those limitations, but I think the thing that, and you've played with it.
Yeah, actually use it. I'm actually a subscriber. Yeah. I have been for some time. So let me give you a real quick use case. For marketing material for Clearsense, we needed to know how many beds per client. So we have 26. I went to ChatGPT, how many beds in the following organizations? Commented them out, less than 20 seconds, I got that count. I then did what I was supposed to do, did the research, went to the websites, I got within 2%. So either ChatGPT is as smart as me, or I'm as dumb as ChatGPT. We got to figure that one out. And I just, $3 to the organization.
We don't have to really try too hard at this point. I think the reason people are excited about it, first of all, is they're not making the promises. So when IBM came, you and I have talked about this, when IBM came into the industry with Watson, it was loud and proud. And we now can use it as a case study of saying, don't come into healthcare saying, we're going to replace doctors. And yes, it is passing exams and it's continuing to advance in those kind of things. Let the world find out if it's going to solve cancer or not. Just introduce the tool set to people and see what they can do. And I think the thing that's happening is, my experience is the same, which is, okay, the hype reaches me. I go out there and use it. And by the way, the hype reached me when it was GPT-3, and I was using it through a third-party application that we were using it for our company. And that tool was effective for us, but it was not great. We used to say, use this tool for a crappy first draft.
Sure.
It's called Jasper AI. So Jasper AI sits on top of GPT-3. And I'm sure it'll be 3.5 or 4 here shortly. And it was a really good tool. It really helped us. It helped us do outlines. We take these transcripts, put it in, and it does a lot of that stuff. And so we've been using it for a while. And then all of a sudden 3.5 comes out. And it felt like it was like overnight, like 3.5 comes out and then 4 comes out. And the thing that's amazing to me is we went from crappy first draft to just telling me that they had professors look at 8 papers, and 4 of them were written by students, 4 of them were written by GPT-4. And the professors couldn't tell which ones were which. And we're getting to that level of quality, which isn't that a pretty astronomical move in a very short period of time?
I think that it's the tech behind it's always been there. Yes, the refinement for what we're seeing is evident. Nothing in the history of mankind from a technology and or from an application perspective has ever gone from 0 to 100 million users in 2 months. That's something to think about. So in a few years back when we look, and Bill, I'm a professor as well, and I will say that from what you just described, if it's a short piece of work, that's correct. But if it's a 5 to 10 page, no, that's not correct.
But it's multiple prompts, you break it down and you can, let me ask you this from a programming standpoint. Because you program, I program, I've written some code through it. In fact, I took a project that I paid $1,000 for about 1.5 years ago, and I thought, you know what, I'm going to take that project. I went out to like a third-party site, got a developer to write some stuff for me. And I decided I'm going to do the prompts and just walk through it. And I had to fine-tune the prompts, but after I got the prompt, it generated the code that I paid $1,000 for.
Also for debugging, it's worked well for debugging as well.
What about documentation? Can you feed code through that maybe isn't documented real well and have it documented? You don't know. Or
No, I've not done that one, yeah.
That would be interesting. It would seem to me like that would be something you could do without much risk, because it's not going to modify the code, it's just going to put in the documents.
Well, think about the use case that's being described here, where that interaction you have with the patient is 100% recorded. That information is then retrieved. And then yes, at that point, could we do something from a generative perspective, where we actually generate a clinic note based on that conversation that happened between the clinician and patient? I think you'll see some of that. So I think from a burnout perspective, if you will, or from a labor perspective, there's some good potential for that, but we'll have to see. It beats a scribe. It would beat having to have a scribe behind you doing all this kind of business and whatnot.
Well, I'm wondering, so, I mean, if I'm coaching all these startups around here, I'm saying, tell me about your business model, tell me what you do. Is there a chance for utilizing these large language models and generative AI? And if there is, you should be plugging into an API here pretty quickly.
You know what you need to do when we're done with this conversation, and I have done it. You know how we go from booth to booth? We ask people what the company does and whatnot, then you ask somebody else, and it's something completely different, and you get like 3 or 4 different. If you take some of these booths, go talk to those people, and then when you go later tonight, run it through Chat-GPT, and you'll get a really accurate depiction of what they do. Probably better than the folks in the booth. I have done that, and it is quite interesting. Yeah.
You're doing some interesting stuff with GPT-4, and that's the thing that's amazing to me is it depends on their perspective, and they come to me and say, this is how I used it. It's prior authorizations. It's
Well, Bill, what if you have a set of data and you're a researcher? I want to know how many patients in my data set are over the age of, let's say 50, that are diabetic type 2, that are on certain medications, and so on and so forth. If I want to count, what a better way to get that count? I can either verbally or type it in and get that response.
So trend or trendy?
Oh, this is definitely a trend that, it really honestly, if you talk about it from a call center perspective and everything else, it started with the IVR.
I do want to talk to you about it from a call center perspective. GPT-4 has a lot of potential for a call center, doesn't it?
Oh, absolutely, especially for information. And the really cool thing about it is because of what we've done from a language perspective, many times on the receiving end, they have no idea that they're talking to an artificial agent and whatnot. And as we get better and better, that's even becomes exponential. So I can use this to give information. Let's say, and it's really interesting you ask that, because I asked for, can you give me this information at a 5th grade level, at an 8th grade level, at a graduate level, and I can get all of those levels as a generated response from that technology. So
and I can generate the script that a
absolutely.
call center agent.
Not even that, but it can actually go back out. So you, hey, name that healthcare organization. My mother has been recently described with dementia. Can you tell me a little bit about what I can expect? Absolutely, from an informational perspective, especially in a curated data source.
How much better is GPT-4 than, like, say, Siri or Alexa? I mean, couldn't it?
Sure, so you're basically doing natural language understanding, but then you're doing the handoff so that you can actually retrieve. So Siri's kind of telling you something that's already there, as opposed to putting something and assimilating information to give you a picture. So if you ask Siri to list a whole bunch of conditions, you're not likely to get any type of diagnostic response, unless they've already curated that from a back-end perspective.
It feels to me like Microsoft just did what no one thought they could do, which is they got first mover advantage over Google in a space that Google was fairly competent in. And now they're going to be able to integrate the OpenAI tool set into all those different, I mean, Microsoft touches everything, all those different areas. Is Google going to be playing catch up on all this for quite some time now?
Well, I think Google has always been on the cutting edge, and they were. They just didn't put it out soon enough, if you will. They talked about it a little bit later, but Google is really good for cutting edge technology, but they don't necessarily take care of you when they switch to something else. You kind of get left holding the bag, where on the Microsoft side, as versions come out, you're not left behind, if you will. So from a visualization perspective, look at Power BI on Microsoft side, look at Tableau and Click and others that you will actually describe what you want that visualization to look like from a data perspective, and it'll be created for you, which that's quite significant. So I look at this from a data retrieval to kind of my thing, to be able to interrogate a curated data set and get that information back without having to do the keyboard thing and spend an inordinate amount of time. I see it as a time saver for a lot of the tasks that we do currently.
It feels an awful lot like the start of Star Trek, when they would say, computer do this, computer do that. If you look at the progress we've made in the past year, and somebody was saying to me, where do you think GPT-4 will be in 10 years? I'm like, I mean, literally, I cannot imagine, because you take that model, and there's no way for us to train it, by the way. I mean, that's not true. You can train it through prompts, but it doesn't remember, it has no long-term memory on the prompts.
Yeah. Bill, for healthcare, I like the technology of Chat-GPT from a interrogation perspective, but I would like that technology on curated data sets that we've created and curated. I would love that, because then I have some assurance that what comes back is going to be as accurate as possible. And that's really important. And I always talk about this, Bill. We as human beings can make mistakes and being forgiven. The technology gets one shot at it, and boom, you got a little bit of a problem.
We'll get back to our show in just a minute. We have a great webinar coming up for you in April. We just finished our March one on April 6th at 1 p.m. Eastern Time, the first Thursday of every month. We're going to have our leadership series. This one is on CISO priorities for 2023, Chief Information Security Officers. We have a great panel. We have Eric Decker with Intermountain, Shauna Hofer with St. Luke's Health System out of Boise, Idaho, and Vic Aurora with Hospital for Special Surgery. And we are going to delve into what are the priorities for security? What are we seeing? What are the new threat vectors? What is top of mind for this group? If you want to be a part of these webinars, and we would love to have you be a part of them, go ahead and sign up. You can go to our website, thisweekhealth.com. Top right-hand corner, you'll see our webinar. And when you get to that page, go ahead and fill out your information. Don't forget to put a question in there. One of the things that we do, I think that is pretty distinct, is we collect, like for today's webinar, we had 50 some odd questions that we utilized in order to make sure that the conversation is the conversation that you want us to have with these executives. So really appreciate you guys being a part of it, and look forward to seeing you on that webinar. Now, back to the show.
Yeah, we talked about that for a while. All right, so we've spent a lot of time on this.
Oh, I know, and you've done really well. We're up to like a $50,000 or something like that. Yeah.
Well, we have raised a fair amount of money for Alex's Lemonade Stand. Captains walking around here, and everybody's getting their picture taken with them, which is great. As we look at the challenges facing healthcare, there's a lot of discussion around, obviously, the financial challenges that health systems are facing, there's still burnout and clinician shortage challenges that are facing healthcare as well. And there's this overarching question, which is, how do we continue to improve the quality of care while being cost effective in the process? What are you seeing or what are you hearing in terms of how we're going to be able to do just that, to continue to improve the quality of care, because that's what we're after, while doing it in a cost effective manner or even reducing costs out of the system?
Sure. So I always answer that with a data answer, because we have all of the data that was required to make those decisions, not just from a here and now, but also from a forecasting perspective, but we don't do it. We've been flying by the seat of our pants since the beginning, and we're always looking in the rearview mirror. We've got ourselves to a point now where we can't do that anymore. So by having an environment of data that's actually trusted and the requisite tools on top of that, then we can start making certain decisions and whatnot. We've got to make those hard decisions. There are verticals within our organizations that are not patient effective, nor are they profitable. And we got to make some hard choices and whatnot. From a documentation burden and so forth, Florence Nightingale said it better than anybody. Document if you must, but only document that which is required. We've gone nuts with documentation. There's some regulatory requirements and there are some clinical needs, but let's not do any more than that. Let's not use our EMRs and other systems as this crazy data collection system for data elements that we're not using. We know what the critical data elements are, both financial, both operationally, research, and clinically. So let's just stick to that and we'll be in a lot better shape. There's too much mess, if you will, that we got to get down, because it's a situational awareness exercise. A little bit about the past, what's going on now, and what's likely to happen in the future, and then we got to make decisions based on that.
Is there a way to look at the data, when we talk about Clearsense, we talk about data transparency, is there a way to look at the data and see, hey, we collected this data, but we're not using it? Some of this is going to be a moot point because there's regulatory requirements that require us to collect data that we're not using.
Yeah, absolutely.
But is there a way to identify the data that, hey, you know what, we've collected all this data
and it never shows up anywhere.
It never shows up anywhere.
So we did something very similar with order sets. Remember when we started the EMR?
Oh, yeah.
We built thousands of order sets, and then we did inventory, and we found out we're only using like whatever that percentage was, and you kind of get rid of them.
In the old days, it was like reports.
Yeah,
it's like,
absolutely.
It's like, hey, we're up to 3,800 reports. It's like, 3,800 reports? What? Is everyone using those reports? Like,
no.
And then you do the inventory and...
No, Bill, what I used to do with those reports is I would write, hey, in bold in the report, in the middle of it, hey, if you're reading this, please call me, because I want to talk to you about this report. And I'd never get any phone calls from most of these reports, so I would delete them and nobody would ever know. So can we do that from a data perspective? Yeah, we absolutely can. What are we bringing in that we don't need? But more importantly, the organization from a governance perspective, what do they have that they don't even know that they have that is absolutely purposeful and actually can help them? Hey, we've got clinics that are operating these hours, they need to change to these hours. We've got practices that are just minimal.
I talked about that with Rob DiMiche from UPMC, former CFO for UPMC. He was just talking about, because I was saying, do we need more data? And he goes, not. We probably have enough of the data. We need to get it into a form and get it in front of the right decision makers so that they can look at it and say, you know what, we put those locations in the wrong place, they should be here and here, and we would actually, just by moving those locations and ending those leases, we would increase access, we would increase our quality, we would increase the population health in those communities.
Yeah, the simple discovery of best practices in the data. We have evidence-based practice, we call it that. Many times it's eminence-based practice. Who is the person that is noted for this type of therapeutic endeavor, regime and whatnot? But Kaiser and others look at their data and they find the best practices within the data, then they implement them, and of course the costs come down, the patients do better, and so forth. So yes, I think these data sets that we have will absolutely tell us what we need, but they got to be put in a way that's accessible and, more importantly, is trusted. So that when we get in a room and somebody sees something on the wall and they challenge it, it's correct. Not they challenge it and they're right. And now we've just lost all credibility. We start all over again.
Well, Charles, it's always great to catch up with you and talk about GPT-4, and just to have that conversation about GPT-4 was really helpful to me, and just understanding where GPT-4 is going in the future. And there's $3 more for Alex.
There you go.
Understand, and I
All
really
right.
appreciate
Thanks, man.
appreciate your time.
it. Yeah.
And that is the news. If I were a CIO today, I think what I would do is I'd have every team member listening to a show just like this one and trying to have conversations with them after the show about what they've learned and what we can apply to our health system. If you want to support This Week Health, one of the ways you can do that is you can recommend our channels to a peer or to one of your staff members. We have 2 channels, This Week Health Newsroom and This Week Health Conference. You can check them out anywhere you listen to podcasts, which is a lot of places. Apple, Google, Overcast, Spotify, you name it, you can find it there. You can also find us on YouTube. And of course, you could go to our website, thisweekhealth.com. And we want to thank our Newsday partners, again, a lot of them, and we appreciate their participation in this show. Cedars-Sinai Accelerator, Clearsense, CrowdStrike, Digital Scientists, Optimum, Pure Storage, SureTest, Tausight, Lumion, and VMware, who have invested in our mission to develop the next generation of health leaders. Thanks for listening. That's all for now.